Hi, I'm Dr. Lynn. I'm going to show you how to skin roll your abdomen. This is a technique that can help lift layers of skin and fascia away from sensitive muscles and nerve and vascular structures to create more space or breathing room for sensitive nerves. You're going to make your hands into a sandwich grip. Gently pick up the tissue, and then maintaining a gentle outwards pull or lift, you're going to open up that sandwich grip, reach further down your body, and then drag your fingers to meet each other. Okay, let me show you again. So you're gonna first grab the tissue, get a sense of its elasticity. Okay, and then open up your sandwich grip, reach further down your body, and then drag your thumbs to meet your fingertips. With practice, try doing this while maintaining a little gentle outward pull or lift. At home, you can do this undressed below the waist and continue all the way down across your groin and into your upper thigh. Try at midline. Your rectus abdominis muscle goes all the way from your fifth rib down to your pubic bone. So start up on your rib cage, just to one side of the center line. Pick up the skin. And now let's try walking the hands one at a time. So I'm going to use one hand to maintain the outwards pull. The other free hand, I'm going to reach further down my body and then pull the thumb towards the fingertip, maintaining that outwards pull at the same time. And then I'm going to use the other hand to capture the tissue and pull it down the neck segment. Okay, let's try that alternating hands technique again. So first lift the tissue, and then one hand's going to advance and pull, while the next hand walks down to meet the thumb and captures the next chunk of tissue. And you're going to continue like that, going all the way down the abdomen. Again, if you're doing this undressed below the waist at home, you'd want to continue all the way down over the pubic bone. Let's try the other side. I'm going to turn sideline a little bit just so you can see from a different angle. So I'm lifting the skin. You could use a two-hand synchronized technique where you're going to pull thumb to fingertips, almost like an inchworm inching down your trunk. Or you could use alternating hands. We're going to advance one hand and then capture the tissue with the other. And keep pulling, fingertip to thumb, alternating. Again, try to maintain that gentle outwards pull or lift as your hands move. If you find an area is particularly tight, say for me, if this left side wall of the abdomen didn't have much lift to it, it was hard to pick up the skin, I could stop moving and just gently pull outwards and then wiggle. I'd recommend using two hands, but I'm just going to move this one so you can see better. If this felt restricted, like it wasn't as slidey and glidey and elastic, I could just pull outwards and then shift from side to side and up and down. And just notice if one direction feels restricted, if it does. So say for me, if the downward glide felt restricted, I could just hold it while I breathe deeply a few times. And then wiggle it again just to see if it feels a little looser. If not, I could repeat that. I could grab the tissue again, gently pull outwards, glide it downwards. Take a few deep breaths, breathing really deeply into the side of my rib cage. And then see if that glides a little bit more easily. And then I could try my moving hands technique again. Again, if you're doing this undressed below the waist at home, make sure that you go all the way down over the groin area into your upper thigh. And then when you're working on the center line of your abdomen, you go all the way down over your pubic bone. And you can even ask a partner to help you. If you have a lot of tightness in your sides, you could ask a partner to help skin roll over the top of your pelvis along the rim and across your back, coming along this edge, bottom edge of your rib cage. Okay. As you can see, you can sort of do it on yourself, but it's easier if you have a partner's help. You can also experiment with whether it feels better to have your knees bent, which slackens the groin and abdomen a little bit, or if it feels better to have your legs extended. You may find that when you're first doing this and practicing maybe just on the abdomen, it feels better to have your legs bent, maybe supported with a bolster. But then as you come down into the groin and leg more, you'll likely need to straighten at least one leg just to open up that area so your hands can walk and pull the skin and fascia down across that transition zone. Give it a try and let your therapist know if you have questions.